Good day for all of you who have joined today for this conference. After many years of trying to catch up with the missed school time due to COVID-19 and economic recession, we are finally almost there after 3 long years, where the academic year will overlap perfectly with the calendar year. And this is the perfect time to reflect what was the impact and what we could have done better in school education during the COVID-19 and the subsequent economic recession. My dear friends, I am here to brief you about our study titled The Impact of COVID-19 on the Dynamics of the Sexual and Reproductive Health Education at Government Schools in Sri Lanka. I am Malith and I am presenting today on behalf of my research team, including Ms. Savitri Gunathilaka and Professor Indral De Silva. The provision of sexual and reproductive health education in Sri Lanka is a crucial long-term investment that shapes the future health and well-being of young people. However, the COVID-19 pandemic significantly disrupted this essential service, posing long-term unprecedented challenges to the delivery of sexual and reproductive health education in state schools. We work on 2 objectives. First, to describe the difficulties encountered in teaching SRH during the COVID-19 pandemic. Secondly, to assess the impact of the pandemic on the provision of the sexual and reproductive health knowledge in the schools. Moving on to the methods, this was a cross-sectional study using snowball technique to recruit teachers. We conducted this research online using a Google form which was shared via email and social media applications. And this study was conducted in all 3 districts in the Western Province and Galle and Radhapura districts, and these were conveniently selected. On eligibility criteria, participants were recruited if they teach sexual and reproductive health subjects for grades 6 to 11 in government schools for at least 1 year before the data collection. No personally identifiable information was collected. Data was summarized using graphically representations and tables. Associations were tested using Fisher extract. Moving on to the interesting part of my presentation, our study sample consisted of 60 teachers. More than 4 teachers out of 5 were females. The mean age of the teachers were 40 years. And 65% of the teachers were from the mixed schools. And most teachers were from the urban schools. And 3 out of 4 teachers were employed in the schools in the Western Province in Sri Lanka. So shifting our focus to experience, close to half of the teachers were experienced 10 years or less, whereas 3 to 4 teachers had only 10 years or less experience in teaching sexual and reproductive health at schools. During the peak of COVID-19 in 2020, we all had the experience of lockdowns and school closures. Hope you all remember the struggles we had with online teaching, which was a novel experience at that time. However, still, 75% of the SRH teaching was only conducted at classrooms in 2020. And 4 out of 5 teachers expressed difficulties in conducting SRH content online. But more than half of the teachers were actually satisfied with their effort teaching online. Interestingly, 70% believe that lack of sexual and reproductive health inputs due to COVID-19 will have a negative impact on the students in the long term. This table describes the percentage of the SRH syllabus coverage in the year 2020. I would like to draw your attention to the poor coverage of the SRH content in the 2020 academic year, irrespective of the method of content delivery to the students, that is either online or physically at the classrooms. This table compares the SRH delivery to students in grade 6 to 11 in the government schools. As you can observe, there's a significant drop in the syllabus coverage in the year 2020 compared to 2019. Mind you, here we have compared the academic years and not the calendar years. And despite this adjustment, the difference is still significant. In fact, at least 75% of the SRH syllabus were not covered by any of the school teachers from the rural and state sectors, whereas more than 40% of the urban sector teachers achieved it. None of the SRH teachers outside the Western province covered at least 75% of the SRH syllabus. In contrast, 35% of the Western province teachers covered it. In addition, at least 75% coverage of the SRH content in the boys-only schools were only achieved by 1 in 9 teachers. In comparison, 36% of the mixed and as high as 55% of the girls-only schools achieved this mark. And this is one of the quote by a teacher to our question on if you're faced with the difficulties in teaching SRH content online, explain why. So the teacher highlights the difficulty in teaching the sexual and reproductive health content online due to the cultural issues associated with teaching the sexual and reproductive health content at the home environment, as well as the general concern that is students were not attending the online sessions during the COVID-19 pandemic. So, looking back our results, we concluded that COVID-19 severely affected the formal SRH teaching at state schools. Not only that, the COVID-19 pandemic has disproportionately affected the delivery of the SRH education in the state schools, particularly those located outside the Western province and in the state and rural sectors. Another major concern that has emerged from this situation is the inadequate delivery of the sexual and reproductive health education to boys. On recommendations, the future strategies to enhance the delivery of the SRH education should focus on improving teacher skills with a particular emphasis on underserved state and rural sectors, as well as the schools outside the Western province. This targeted approach will ensure that all students, regardless of their location or gender, will receive the necessary SRH education. Further, students who did not receive an adequate level of the sexual and reproductive health education from schools due to the COVID-19 pandemic and the economic recession are required to be educated via out-of-school programs. The major limitations of this study are: number one, the sampling technique. Due to the limited resources and difficulties in recruiting SRH teaching staff, because they are limited to 1 or 2 in numbers for most schools, and to recruit 60 teachers would be very, very difficult. Secondly, with the convenient sampling, we ended up with the majority of the teachers representing the urban sector and in the Western province. Thus, we should be careful in generalizing findings. So these are my references, and thank you for listening.